Hi, my name is Dr. Joe Sirven. I am on the editorial board of Neurology Now, and I am a neurologist who specializes in seizure disorders. And sitting down with me is Dr. Jennifer Molano. She is an associate professor at the University of Cincinnati, and she specializes in both sleep disorders and in cognitive or behavioral neurology. So Jennifer, it is great to be talking to you.
Thank you very much. It's great to be here.
Well, let's start off. I know one of the biggest questions that people often ask me, and that I ask people like yourself, which is, what is dementia, and what's the risk of getting it? Because I know a lot of people get nervous since it's talked about so much.
Right. So dementia actually is when someone has issues with their thinking. It's more than what you would expect for age after a physician actually tests for it. And the other piece of it is that they need supervision in order to do day-to-day functioning.
Okay.
And so there are different types of dementia. A lot of times the question that I get asked is, what is Alzheimer's disease, and is Alzheimer's disease dementia? So I tell people that dementia is an umbrella term and Alzheimer's disease is a type of dementia.
Okay. What is the risk of getting a dementia?
Specifically for Alzheimer's disease, the Alzheimer's Association put out some data saying that at the time of 65 years old, the lifetime risk of subsequently developing dementia is about 17% in women and about 9% in men.
Okay. How do you get that risk down?
What we're finding out more and more, specifically with Alzheimer's disease, is that for about 15 to 20 years before someone develops problems with their memory in particular, people may not have symptoms, and we're finding out that in midlife some of the risk factors include high blood pressure, diabetes. Right. Some of the things that we recommend is, a good heart, a healthy heart means a healthy brain. Okay. And so making sure that the blood pressure is under good control, making sure that the blood sugars are under good control, making sure that the weight is also within normal limits. I think those are important keys.
Does that mean then exercise and is like the top priority, or the right eating is all top priority in terms of making sure that we prevent it?
Yes, and so, exercise and physical activity is probably one of the most important things that people can do, and there's strong data to support that. It's been a range. Some people have said mild, some people have said more moderate to heavy exercise might be helpful. Right. So I think we're still trying to figure out the right amount and the right intensity to help prevent cognitive decline, but certainly the more you move, the better your brain will be.
One of the questions that people often ask me, and I think many of these are my own relatives oftentimes, is that, I forgot something. Does that mean I have a dementia? I mean, what's the difference between I forgot something related to normal aging versus I forgot something and wow, I really need to see someone for this? A
lot of times I think, as we get older, we do tend to forget certain things. We may forget names, but the key is that you may remember them. It just may take a little bit longer. Compared to someone who may have an issue, they may not necessarily recall that information at any point in time.
If you're worried, or someone out there watching this is worried about the possibility of a dementia or something in that direction, what's the best advice?
I think, anytime if you're having any sort of concern, and I think this goes not just for memory and thinking, but goes for any sort of symptom, it doesn't hurt to talk to your primary care doctor as a start about that. And then, they may do further testing with some lab work, like checking the thyroid or the B12 level as an example, and they may even do a short thinking test to kind of see where someone may be, and whether or not a referral to a neurologist might be beneficial.
Listen, I really appreciate you kind of talking to me. This is all great advice. It's helped me out a lot. I appreciate it.
Thank you.